The Medgun, the Curelife medical tool, the ParaMed medical device. Whatever name you use for this tool, most people have carried one on their hip at one time or another. Some don't leave home without one, some may never have heard of them, but this little white tool is a godsend, and in trained hands, you can even cure afflictions for a short time. Turn a limping patient into a track and field champion. So, do you fancy becoming a medic? Then let us give you the tools to use your tools effectively. To understand how the Medgun works, you first need to understand how the injury system works in Star Citizen. Currently, you can be injured in 3 key areas: the chest, the head, and the limbs. Each area has 3 levels of severity, known as tiers. A level 3 injury, or tier 3, is typically minor, and while it comes with some negative side effects, may not affect your play too much. A tier 2 injury is classed as moderate, while a tier 1 injury is severe. A severe injury, or tier 1 injury, to most body parts will render that body part as non-functional. Tier 1 to the leg, can't stand. Tier 1 to the arm, can't hold a gun, and in combat, this is bad news. It is also possible to have multiple body parts injured in multiple tiers at the same time, but this is worse news. To compound matters, there is also a drug intoxication mechanic that punishes you if you overdose. So, getting drug doses correct is super important. A trigger-happy medic can actually make a bad situation much worse. Your medical gun can relieve these symptoms for a short time, which can enable you to extract and heal at a medical facility. And yes, you can use these functions on yourself, not just a patient. Now that you understand the basics of injury, let's delve into the advanced features of your Medgun. Firstly, when you equip your Medgun, it will default to Shoot Someone Else mode. To switch this mode to use on yourself, you should press the B key. The B key is default key binding for the alternate fire mode for your weapons. And as a side note, you really should try pressing this key for your other weapons just to see what happens. Currently, the medical gun is disabled for use in safe zones, since it is possible to do bad things with it in these areas. The only way to revive someone in a safe zone is to right click with a med pen equipped. To use the advanced features of your gun, you should first right click with it equipped to put it into an aiming mode, and then press and hold the F key. This enables you to use your mouse pointer to click on the slider bar at the top of the gun and put it into the advanced mode. From here, the display will change and present several different options. Let's break down what you see on this new panel. The names of the drugs are listed here on the left. More on these later. Near the bottom of the display is a blood drug level or BDL indicator. The broken bar in the middle represents a BDL of 100%. Administering too much medication can cause fatal overdose, and you will start to actively lose health. 1/3 of this bar, or 75%, is considered our safe zone for drug administration. Above 75%, your patient will start experiencing the effects of intoxication. At the center of the display are a series of slider bars. By holding the same F key, you can increase or decrease the drug doses to a set requirement. To the right of the slider bars are a series of numbers that represent dosage length in minutes and seconds. Consider the slider bars a slippery slope to accidentally overdosing your patient. If you make a mistake, you can reset your selection by pressing the clear button. The auto button is currently unreliable, so ignored for the purposes of this video. Usually, a short 5-minute dose is enough to get your patient out of danger and closer to a medical facility. Note that your patient does not need to be at 100% health to move. Above 50% will give room to play with supplemental drug doses if required. Highlighted at the bottom of the display, you can see the overall estimate of the applied drugs on BDL. The gun will then deliver no more than selected after pulling the trigger on your selection. While it is important to learn the drug types and what they do, note that the medical gun will give you the information on required drugs to return near normal function to your patient. We go in depth regarding these drugs during our in-game training sessions, but for now, a simple way to understand them are as follows. Hemazal returns health, stops bleeding, revives patients. Roxafen, an opiate medication. This is a painkiller, helps return function to limbs, normalizes movement capability. Demexitrine, adrenaline, reduces concussion symptoms, helps normalize weapon handling and movement speed. Sterigen, steroids. These reduce inflammation, and anti-inflammatory medication reduces vision and hearing symptoms and normalizes stamina. All of these MedPen-based drugs can be found in your medical gun. They provide symptom relief, and a combination may be required to get your patient functioning normally. The symptom relief is instant and lasts for as long as the drug remains active in your patient. They will slowly metabolize these drugs, and their BDL will decay over time. One last drug we have not yet mentioned is Resurger. This is a detoxifying agent that increases the decay rate of your BDL. This is the only drug that does not have an immediate effect and takes time to work. It will continue to quickly decay the rate of BDL as long as it remains active. Resurger is the only drug that does not increase BDL. Linking this theory to practice, the next bit is as cool as the snowman's pants. Scanning your patient with the Medgun equipped will display further information that can assist you in deciding what drugs to administer. Here we can see, based on the information provided, that our patient has a Tier 3 head injury and will need Demexitrine and Sterigen in order to relieve symptoms associated with the injury. When we have all this information, we can plot this into our medical gun using the advanced feature. Set the drug doses and length of time we want them active using the slider bars, point and pull the trigger. Your patient should now be able to stand, run and shoot despite the injuries. Of course, they will need to access a medical bed to heal the injuries, but drug masking will be in effect. Medical gameplay is subject to change if CIG revisits this mechanic, but after watching this, you should have a basic understanding of the advanced features, display information and symptom relief provided by your medical gun. We want you to look forward to your in-game teaching sessions, where these topics we have briefly explored here will be described in detail by your Academy staff. Make sure to sign up to the next in-game medical gun teaching activity, and we will see you there.